Warranee, my name is Karen Few. I'm the First Nations Health Access Officer for the PHN. Just like to welcome you all to Session 5 of our Quality Improvement Program, the CTG PBS Co-Payment Measure. I will now start the presentation. I would like to acknowledge and celebrate the diversity of our First Nations culture and pay my respects to the elders past, present and future as the traditional caretakers of the lands and waters we are working on today, and any First Nations participants joining us on the webinar today. We will now start the presentation. The learning outcomes for today's session is what is the CTG PBS co-payment program, who is eligible, how to register the practice, how to register a patient, and how to check if a patient is registered for the CTG PBS, and how to set up a delegation access for providers through HPOS. What is the CTG PBS co-payment program? This program was established in 2010 to improve health outcomes for our First Nations people who are living with or at a risk of a chronic disease. Patients can access affordable medications under the PBS general schedule at their local pharmacy or private or public hospitals. Patients who are registered for the program will receive a concessional rate for their medications. If patients are already on a concessional rate, they will receive their medications at a lower cost or for free. Health professionals can support First Nations people access low cost or free PBS medicines by registering them for the Closing the Gap Pharmaceutical Benefit Scheme, PBS co-payment. So who is eligible for the CTG PBS co-payment program? Patients who self-identify as a First Nations person and are enrolled with Medicare and have barriers in preventing or managing their chronic condition. If they don't take their prescribed medications and are unlikely to keep up their treatment without help with the cost of medications. Their age, where they live and their chronic disease status makes no difference. The person only needs to be registered once. It's for all ages and the patient doesn't need to have a chronic disease. There is no registration form to be signed for the CTG PBS co-payment program. Only verbal consent from the patient is needed. A patient only needs to be registered once for the program, and the registration will be active even if they transfer to another health service. In remote areas with limited internet access, a health service or clinic can phone Services Australia to register the patient for the program. If for any reason a patient no longer wants to be registered for the program, they can contact Services Australia or go to a service centre to advise they no longer wish to be registered for the program. 60-day prescriptions will benefit many people, especially those who live with an ongoing health condition. Medications are available for a 60-day prescription, have expanded to include, but are not limited to, patients for ongoing conditions such as anxiety, asthma, COPD, glaucoma, Parkinson's disease. There's quite a lot. The patient can get 2 months supply of their medications on a single prescription instead of having to previously get 1 month supply. The GP or health worker just needs to consider if this is the right decision for the patient. If the patient lives in a rural or remote area that have trouble accessing the pharmacist, then this is a good way for the patients not to miss out on any of their medications, whether they're at home or travelling. I've put in a few slides here to explain how to register a patient for the CTG PBS co-payment program. To access, you just need to click on My Programs tile and just follow the instructions. You just need to click on the Closing the Gap PBS co-payment register tile to start the registration process. Just be mindful that your layout on your screen in your office might be different to that of this screen, depending on your delegation. You'll then be taken to this section of the Closing the Gap PBS co-payment register. This is where you will search for the patient's name. You can either search by the Medicare card details or by the patient's name. The bottom section that you see here in the red box is where you'll be able to see your patient is registered or not. Changes that were made to the CTG PBS co-payment measure from the 1st of January 2024 and from January 2025. Any PBS prescriber or Aboriginal health practitioner can register eligible First Nations people for the program. Eligible First Nations people can be registered for the program no matter where they live and regardless of their chronic disease status. Registration of eligible people will be via Health Professionals Online Service HPOS. The registration will cover First Nations people if they move to a different health clinic. Practitioners will no longer be legally required to write CTG on the prescription. However, annotation of a PBS script will help pharmacists know that the patient is registered. PBS prescriptions issued within public hospitals will now be eligible to be dispensed by any community pharmacy or approved private hospital pharmacy. Setting up a delegation is an 8-step process where you need to log on to HPOS and select your details, the delegates, and if you needed to add a new delegate. If the practice would like, I can send this through in a Word document through an email. And the delegation access amendment is a 6-part process. It's how to log on to HPOS and the details of delegates, how to edit against the delegation you wish to change, you amend the services, and then you confirm the update. I can also send this through on a Word doc as well. Health Pathways is a free website portal for all clinicians, GPs, practice nurses, allied health professionals, with a lot of information on how processes work and the actual referral process. We have a First Nations Health, a lot of pages on here to do with CTG, CTG PBS co-payment, there's ITC, chronic disease management. There's a lot of information on this page. You just need to log in and have a password. Please feel free to access this slide for references and websites, which I have added to this slide for any other information you may require on the CTG PBS co-payment. Underneath the presentation there's a survey link. If you wouldn't mind completing this survey, it should only take about 3 minutes. That will help us with our education sessions in the future. You can also access our First Nations Health website. All the presentations are on our website under Practice Support Sessions. I would also like to thank all participants for participating in the Quality Improvement Program. I hope that has been helpful. Thank you.